Let's move to the national capital now, which is grappling with the worst dengue outbreak in the past 5 years. Delhi Chief Minister CM Kejriwal held a crisis meeting and asked all party MLAs to visit hospitals daily to monitor the situation personally. The MLAs have also been asked to carry out an awareness campaign about the disease. In a meeting with Chief Minister CM Kejriwal and Health Minister Satyendra Jain, all MLAs were told to visit hospitals. They have been told to coordinate with hospital authorities, and if there is any need for improvement, then they should inform the government. The Delhi government has also decided to cancel all leaves of doctors and paramedical staff. Meanwhile, the Union Health Ministry has also asked the Delhi government to take action against any overcharging by private hospitals while providing treatment to dengue patients.
दिल्ली सरकार कॉर्पोरेशन से झगड़ रही है, एक दूसरे के सर के ऊपर ठीकरा फोड़ा जा रहा है और ये दोनों की मिसमैनेजमेंट है। और दिल्ली सरकार का जिसके पास में इतना बड़ा बजट है पब्लिसिटी का, उसने इसके ऊपर कोई पैसा नहीं खर्च करा।
Joining us now is Anindo Banerjee for more details on the dengue scare in the national capital. Anindo, even though the government claims to have asked hospitals to arrange and make extra space for more patients to be accommodated, what are doctors telling you about the kind of help that the government itself is extending to them to deal with the situation?
Well, Maha, we at India Today visited multiple hospitals yesterday. We went to various hospitals, both under the central government that comes under the Ministry of Union Health Ministry as well as the Delhi government. But the state of affairs is not very impressive, you see. I mean, we have been to LNJP where we have seen in one bed there are 2 or 3 patients being accommodated. In RML, we have seen one patient on the stretcher, on the same stretcher, another in the emergency, on another patient with an oxygen mask on. So this is the kind of state of affairs within the hospitals. The doctors are doing their best. One doctor is attending at a time to 8 or 10 patients. They're trying their level best, but there are certain deficiencies as far as beds are concerned. Though Satyendra Jain has ordered 1,000 beds, but those are yet to arrive. They're considering the fact there are bureaucratic red tapeisms involved. But to be fair to the Delhi government, they have pulled up their socks. They have ordered 1,000 beds. They have cancelled all the leaves of the doctors and the paramedics. They've asked that, as you rightly said, the MLAs to monitor daily, and importantly, they've also asked 300 municipal ward boys to also get involved in the whole process to make sure that whatever the understaffed hospitals are, those things are taken care of.
Right, action being taken belatedly by the government. There are already 2,000 cases of dengue in the national capital and 400 cases in the last week alone. Anindo, many thanks for updating us with the details. Now, let's take a look at the steps that the government is taking to tackle the dengue menace in the capital. As Anindo was pointing out, all the leaves of doctors and paramedical staff have been cancelled. That's the first step that the government has taken so that there is adequate staff to take care of all the dengue patients that are coming in. In fact, the other things that the government is doing at this point is that it has ordered all the MLAs to conduct first-hand checks. That was done in a meeting with the Chief Minister CM Kejriwal. Increased dedicated dengue staff at hospitals. There will be more ward boys also, is what we understand, to help out the doctors. Additional beds are being arranged at all hospitals. About 1,000 beds have been asked to be arranged in various government hospitals, and 300 municipal staff is on specialized monitoring at the moment. Remember, many patients were complaining that they were turned away by some of the hospitals. In fact, the glaring case was of the 7-year-old little boy Avinash, who was turned away by many hospitals, and after which he passed away, and his parents, who were distraught, committed suicide.